Nicole, go ahead.
All right. Hi, everyone. Thank you for taking the time to join us. This is our 15th congressional staff briefing. It'll last about 1 hour. During the call, we're going to discuss the latest asbestos facts, stats, how asbestos impacts your constituents, the nation, and we'll also discuss the Alan Reinstein Ban Asbestos Now Act. You will have the chance to ask the experts who are presenting questions at the end of the briefing. If you do have any questions, please type them into the chat box. It's the function down on the bottom right. We'll be recording the presenters. However, when the Q&A comes up, we're not going to record so as to keep everyone's privacy. And then a few housekeeping notes. Please be sure to mute yourselves and stop your video so that we can focus on the presenters. That function is down in the bottom left. And I think that's it. Thanks so much. And here is Linda Reinstein, the co-founder of the Asbestos Disease Awareness Organization.
Thank you, Nicole. So good morning from California. I am that girl, Linda Reinstein, the co-founder of the Asbestos Disease Awareness Organization. And for those of you who I haven't met, I am a mesothelioma widow. I want to thank you for joining us today because I know that means you might have a baby on your lap, a dog leash in your hand, and I know that you have worked so hard for your boss and the nation during this pandemic, and it's been hard. We understand that. Today, you're going to hear from a panel of experts that have about 300 years of experience. We're going to share with you the latest asbestos facts, stats, studies, and of course, information about the bicameral Alan Reinstein Ban Asbestos Now Act. I think it's very important during these discussions to try to figure out who's who, is I want to make sure that you understand that ADAO is an independent nonprofit, and we are dedicated to preventing all asbestos-caused diseases. We do not make any legal referrals at all. That is not what we do. And each day, asbestos impacts Americans in your district, in your state, throughout the nation. It impacts Americans by way of asbestos in their home, legacy, could be in their schools, workplaces, the environment, and of course on consumer shelves. Our experts today will talk to you about this, which is hugely important. I am deeply sad to share that Matt Mueller is now had passed away in April. He came to Washington. Many of you may have met Matt. He was an amazing warrior, as we call ourselves. He shared his story and his conviction to ban asbestos. So we are dedicating our briefing to Mike. It's a pretty hard discussion to talk about asbestos, this invisible fiber. You can see on this signature penny slide about 20,000 fibers compared to grains of rice in human hair. That's why we need your boss and this bill to pass so we can protect all Americans. And frankly, we need to join nearly 70 other countries that have banned asbestos. It's really important that we give a shout out to the Energy and Commerce House Committee, both the minority and the majority, who worked tirelessly with all stakeholders to pass out of committee this bill with a vote of 47-1. That's right, 47-1. I am really excited to share that Senator Daines and Senator Merkley have a strategy. After the House passes their bill, that language will become the new Senate language. So we have a strategy. Yes, we have limited time, but we can do this with your help. We know that. For those of you who have a boss who's a co-sponsor, we say thank you. And if your boss isn't a co-sponsor, we can make sure that we get you the right information because I'm sure your boss wants to be part of this landmark legislation that will indeed finally ban asbestos and actually do more. It will be important for you to know that today there are self-introductions, but we've made it easy. What we do, since it's our 15th staff briefing, we prepare what we call a briefing resource page where you'll be able to find an executive summary from our speakers, their bios, information about the bill, 2 studies, and probably far more. And it will be a changing live document to help make your life as a staffer easier to get back to your boss and prepare that important memo. Here's a list of our speakers. They are nothing less than amazing. I got a message from Dr. Raja Flores. He is the chief thoracic surgeon at Mount Sinai. He has to go into the OR this morning, so he sends his regrets. He will be trying to save a life. And you can all imagine how hard it is for a thoracic surgeon with COVID to be doing mesothelioma surgeries and other surgeries during this difficult time. Raja wanted me to share an important thing he usually says at our briefings, that you and your boss have more power in a pen than he has in a scalpel. More power in the pen than Dr. Flores has in the scalpel. So as we think about what Raja is doing today and the Matt Mueller family that is grieving the loss of their son, I want us to be proactive and think about what we can do by passing the Alan Reinstein Ban Asbestos Now Act. That's it. I'll return back at the end, but I want to introduce a very distinguished gentleman who's also my dear friend, Dr. Richard Lemon. You are next.
Hello. I'm Dr. Richard Lemon. I'm a former Assistant Surgeon General and Deputy and Acting Director of the National Institute for Occupational Safety and Health. I'm also here today as a fellow of the Collegium Ramazzini, which is an independent international academy of 180 invited members from over 30 countries, whose purpose is to bridge the gap between the world of scientific discovery and those social and political centers which must act on these discoveries to conserve life and prevent disease. I've been researching asbestos since 1970. And in 1976, I was co-author, along with Dr. John Dement, of the first U.S. Public Health Service report to call for a ban on asbestos in the U.S. workplaces. This occurred in a proposed recommendation for workplace standard on asbestos sent from the National Institute for Occupational Safety and Health to the Occupational Safety and Health Agency, or OSHA, which stated, only a ban can assure protection against carcinogenic effects of asbestos. Unfortunately, such a ban never occurred. Asbestos continues to take close to 40,000 lives each year in the United States. Historically, we have known, based upon epidemiological evidence dating to 1930, that asbestos causes fatal respiratory illnesses. And since the late 1940s and early 1950s, that asbestos causes lung cancer. And by the early 1960s, that asbestos caused a very rare fatal tumor of the serosal tissue lining the lungs, abdomen, heart, and other areas of the body called mesothelioma. But the good news is that we know that the only sure way to stop all these fatal asbestos-induced diseases is to eliminate exposure. In 1976, I was asked by the International Agency for Research on Cancer, known as IARC, the cancer arm of the World Health Organization, to put together a paper summarizing the research evidence on asbestos pertaining to its carcinogenic effects. The agency then convened a panel of experts from around the world known for their expertise, expertise in asbestos disease and cancer research. The panel concluded all forms of asbestos were carcinogenic in both animals and humans, causing lung cancer, mesothelioma, various gastrointestinal cancers, and that while cigarette smoking and occupational exposure to asbestos fibers each independently increase lung cancer, when occurring together, they act in a multiplicative fashion, causing even more risk of lung cancer. Finally, this panel of experts concluded not just workers, but the general population may also be exposed to asbestos fibers in air, beverages, drinking water, food, pharmaceutical, and dental preparations, or through the use of consumer products containing asbestos. Finally, the panel of experts concluded it is not possible to assess whether there is a level of exposure in humans below which an increased risk of cancer will not occur. Today, new panels of experts continue to confirm these earlier findings while discovering more cancers related to asbestos exposure, including ovarian and laryngeal cancers, along with many other cancers strongly suspected of being related, including cancers of the pharynx, stomach, and colorectum. All exposure to asbestos all exposed to asbestos are at risk of developing asbestos-related diseases. Among workers, occupational regulations have reduced these risks substantially, but have not eliminated them. Even at the current occupational exposure standard that OSHA has, 2 to 4 workers exposed to asbestos during their working lifetime will develop an asbestos-related cancer. New research finds even those workers not directly working in the mining or manufacturing sector are at risk of asbestos-related diseases due to the legacy of prior asbestos exposure use. An update by NIOSH released this year continues to confirm findings reported in their study released 7 years ago that firefighters have mortality from mesothelioma at almost twice that compared with the US population. Workers such as firefighters are not the only groups at risk. NIOSH, at the request of Congress, reported in 1995 that family members of workers were dying of asbestos-related diseases from exposures to asbestos brought home from the workplace, or in some cases, simply just by living in the vicinity of workplaces having asbestos or sites of asbestos waste containing products. Today, this NIOSH home contamination study, as well as the NIOSH firefighter study, provides strong evidence that one of the remaining greatest risks for developing an asbestos-related disease can be from legacy asbestos found in buildings, work sites, homes, waste sites, and multiple other sources. Asbestos-containing materials can remain in our environment indefinitely, causing industrial pollution and other environmental contamination as found in soil, water, and discarded consumer products. Scientific evidence confirms that even very low exposures to asbestos can cause asbestos-related disease. Scientists don't know how much asbestos is necessary to cause cancer. However, we know that the amount of exposure can affect the time it takes for the cancer to develop in individuals. For example, latency time, that is the time from the exposure to the development of disease, is dependent on degree of exposure, as demonstrated from studies of workers. Workers with the highest exposures of asbestos tend to develop mesothelioma on an average of around 30 years after their initial exposure, while studies of women having only domestic exposures don't seem to develop their mesothelioma until some 50 years later on average. Why is this important? It means that if we ban asbestos exposure today, that cancers will continue to occur from its exposures for at least another half century or possibly longer. Thus, if we don't identify the remaining sources of legacy asbestos and initiate prevention, then thousands, if not millions, will continue to remain at risk of dying from asbestos-related disease. While some remain skeptical that the background levels of asbestos cannot cause cancer, this is an unscientifically supported assumption. In fact, before the onset of heavy use of asbestos in this country around the beginning of World War II, background levels were very small. However, as consumption of asbestos began to increase, so did the background concentration. Studies found with increasing concentration, markers of asbestos exposure in humans also increased. The fact that asbestos causes cancer and that no known safe exposure has been identified is recognized by both national and international scientific organizations. In fact, over 60 countries around the world have banned asbestos use. If it is for all of these reasons that I speak for the Collegium Ramazzini, support the Alan Reinstein Ban Asbestos Now bill, currently being considered. The longer we wait, the more thousands of Americans that will die from these highly preventable asbestos-related diseases. Thank you, and if I can help you in any way, don't hesitate to ask. Our next speaker is Dr. Arthur Frank. Arthur?
Thank you, Dick, and good morning, everyone. My name is, is Arthur Frank. I'm an occupational physician by training, also an internist, and I have a PhD degree looking at the effects of asbestos on bodily tissues, work that I did back in the 1970s when I worked at the NIH in the lung cancer branch studying the effects of asbestos. I've been engaged in asbestos research for more than 50 years. I started as a medical student with Dr. Selikoff at Mount Sinai in 1968, working in this area. I've published over 100 papers, and unfortunately, I've found myself engaged with medical legal cases involving asbestos, primarily for injured workers and family members, which is something I'd like to see go away because we need, as Dick has already said, to ban asbestos. Over my career, I've seen thousands and thousands of individuals with exposure to asbestos with the development of disease. And my work has taken me literally around the world. I've done research and published from work in India, China, Mongolia, from South America. So I've seen what it does, not only here in the United States, but elsewhere around the world. I've been honored to be part of the world of ADAO since 2004 when I first met Linda, and actually got to meet Alan prior to his death, and have been motivated by that, and hope that others are motivated to keep individuals like Alan and all the other hundreds of thousands of people that have died of asbestos disease safe. I did a project also in Sri Lanka, and what we found there was that cleanup workers after a tsunami were at the greatest risk of all the workers we looked at for developing asbestos disease. And while at the current time we're facing hurricanes in Texas and Louisiana, tornadoes around the country, fires in California, we are going to have ruined structures with asbestos because we've had thousands, millions, literally millions of tons of asbestos in buildings, and people cleaning up those are being put at risk. So the issue of legacy asbestos is quite important. The last comment I want to make is I've been asked to comment on work that Dr. Flores, a colleague at Mount Sinai, who's chief of thoracic surgery, as you heard, who couldn't join us, has recently published a paper on the differential outcome among minorities. We have learned through the recent pandemic and have known for years that minorities in this country do less well in terms of health indicators. And what his research showed is that they have gotten their disease earlier in life than non-white, as non-whites compared to white populations, which means their exposures have been heavier. And they don't do as well in terms of the outcome from their surgeries. They have a higher post-surgical mortality because of the diseases they bring with them. So clearly what is important at this point is we join the rest of the reasonable and thoughtful world and ban asbestos in America. So thank you for hearing my comments, and I'd like to introduce my colleague, Dr. Celestemon Fung.
Thank you. Thank you, Arthur. I am Dr. Celestemon Fung. I am a lecturer in public health at Texas State University, and I've worked in the field of occupational health and safety for nearly 3 decades, including at the Department of Labor. In May of last year, I had the privilege to testify before the Energy and Commerce Committee on behalf of the American Public Health Association in strong support of HR 1603. And joining me at that hearing was Becky Reindell with the AFL-CIO, also expressing their organization's strong support for the bill. APHA is a diverse community of 25,000 public health professionals from every state across the country. We speak out for public health and policies backed by science. And accomplishing these goals requires focus and action on social determinants of health, including exposures to toxic substances, whether they're in the outdoors, in schools, homes, or workplaces. And years ago, APHA called for a complete ban on the manufacture, sale, export, and import of asbestos and asbestos-containing products. Asbestos is a potent carcinogen, and there's no safe level of exposure to it. And for so many cancers, we don't know the cause. You ask yourself, how did I get this? But for asbestos-related cancers, for lung cancer, for mesothelioma, which is so lethal, we know exactly how to prevent it, eliminate exposure to asbestos. It's for this reason that APHA remains steadfast in our support for HR 1603. It is a bill about prevention, about finally stopping this potent carcinogen from being used, and for helping us, families, communities, businesses, know where asbestos is present in our communities. And I think about this bill as having 3 very simple common sense things. It would prohibit raw asbestos and asbestos-containing products from being imported or used. It will require a really important national assessment of the presence of asbestos in schools and homes and buildings and other structures. So we have data to understand the magnitude of the problem and develop smart plans to address the risk. And the last such assessment of this type was done in the 1980s. Knowing where asbestos is located in our communities is essential to protect public health and to tackle the significant health inequalities in our country. As Dr. Frank said, and as the COVID-19 pandemic has starkly illuminated, we have significant health inequalities in our country. And related to these disparities is the unequal distribution of hazards, including asbestos, among low-income people and people of color. They are more likely to live in or go to schools in older substandard structures where they are potentially exposed to asbestos building materials. This assessment is essential for firefighters and emergency responders who need to know when they enter structures whether asbestos is present. And this is information made more and more vital with extreme weather events due to climate change. We cannot prevent asbestos-related cancer and respiratory disease if we don't have accurate data on where it's located, what condition it's in, how it's handled and disposed, and how many people are exposed to it. The American Public Health Association was inspired by the bipartisan 47-1 vote in the Energy and Commerce Committee to approve the bill last November. It was a monumental public health success, but it's very disappointing and discouraging that this common sense public health bill has been blocked from moving to the full House for a vote by one powerful interest group. At the heart of public health is prevention, and the Alan Reinstein Ban Asbestos Now Act is about prevention. It's about people and about eliminating exposure to asbestos. And with that, I'll turn it over to Scott Faber.
Great, thank you. Thank you, Linda, for hosting this event. My name's Scott Faber, and I'm the Senior Vice President for Government Affairs for the Environmental Working Group. Unfortunately, laboratories working for both FDA and for NGOs like EWG continue to find asbestos in consumer products, especially products marketed to children. Independent investigations in 2000, 2007, 2015, 2017, 2018, and 2019 all confirm the presence of asbestos in consumer products, including toys and cosmetics. Just last January, tests commissioned by EWG found asbestos in a talc-containing children's toy makeup set. In May, the same lab found asbestos in 2 talc-containing eyeshadow palettes. Because talc and asbestos can form in the same parent rock, cosmetics made with talc can become contaminated with asbestos. And companies have known since at least the 1950s that talc could be contaminated with asbestos. The public was alerted to this risk in the early 1970s, but the cosmetics industry successfully persuaded the FDA that it could be trusted to regulate its own products and that cosmetics companies should be allowed to rely on an asbestos detection method that could see some but not all of the asbestos fibers. That has proven to be a tragic mistake. How many cosmetics are contaminated with asbestos? No one knows, because the FDA continues to rely on this broken honor system. And while the FDA has finally said that the presence of asbestos makes a personal care product adulterated or illegal, and has finally begun to conduct their own testing, the FDA has not done enough to keep us safe. Many well-known brands continue to use talc in loose and pressed powders that can be inhaled. EWG recently identified more than 2,000 personal care products that contain talc. How much talc is inhaled and how much is contaminated with asbestos is difficult to estimate. But as you have heard, it only takes one asbestos fiber lodged in the lungs to cause mesothelioma decades later. Some companies have reformulated away from talc, but many have not, despite telling us that they plan to do so. It's time to finally ban asbestos. It's also important that companies are required to test products made with talc for asbestos, to use the most sensitive testing methods, and to share their test results with the FDA. Now I'm honored to pass the baton to my friend Lindsey Dahl with Beauty Counter.
Thank you, Scott. Hi, everyone. My name is Lindsey Dahl, and I'm the SVP of the mission team here at Beauty Counter. We are a manufacturer of cosmetic and personal care products based in the United States, and we manufacture here proudly in the United States as well. So we've been around for 7 years, and we are one of the fastest growing beauty brands. And the reason for that is a demand from consumers for companies to be asking really hard questions about the safety of the ingredients that they put in their products. And as we have seen a sea change of consumers asking really tough questions about the products that they bring into their home, asbestos has been top of mind for people across this country. And what you're seeing is a sea change from what used to be the conversation in Washington of industry on one side and public health groups on the other. You now have companies like Beauty Counter that have a sizable presence all across the United States that are openly and asking Congress for action, specifically to take on really harmful ingredients like asbestos that are commonly found in the products that we bring into our homes. At the end of the day, we've got a network of people all across this country of all varying political backgrounds. And one thing really unites us in an otherwise divided country right now. People want to know that the products that they're bringing into their homes and for their children and for people that are pregnant like myself are safe. It's a really basic concept. You have the opportunity right now before you to help make really meaningful change on one of the most egregious examples of how our consumer safety system is currently being failed. Now, I work for a personal care and cosmetics company, and while we are regulated by the FDA, it's important to know there's a jurisdictional difference between the FDA, who we report into, and we believe that cosmetic companies should be held accountable for the safety of the products that they put onto their shelves, which is why we've been advocating both at the state and federal level for legislation to help overhaul and update our broken 1938 cosmetic safety laws. With that being said, the majority of consumer goods are regulated under the EPA, as many of you know intimately. And that is where you have a massive opportunity to take a step forward and to help bring this really important public health piece of legislation across the finish line. We're proud to support this legislation. We hope that you can help play a really meaningful role in taking a meaningful step forward to protect people's lives every single day. Open to questions at the end, and thank you so much. I'm going to turn it over to the Director of Safer Chemicals, Healthy Families, Liz Hitchcock.
Thanks, Lindsay. Good morning, and thank all of you for joining us, and our thanks to ADAO and especially Linda, who provides such inspiring and tenacious leadership. My name is Liz Hitchcock, and I direct Safer Chemicals, Healthy Families. Little technical difficulty. Throughout the legislative campaign to reform TSCA, we led a coalition of hundreds of health, consumer, environment, and business groups to make the case for a reformed law that could truly protect public health from hazardous chemicals like asbestos in our homes and workplaces. The Toxic Substances Control Act, which in acronym Happy DC we know as TSCA, is a tough law to explain to the general public and even to many congressional staff. Explaining what was wrong with the law got real complicated real fast. The blessing that is actually the curse of asbestos is that its story proved to be one of the best ways to explain the problem that we faced with federal law, that EPA tried and couldn't even ban asbestos under the 1976 law. We can understand the dangers of asbestos. The other speakers are telling that story much better than I. Thousands of Americans die from illnesses connected to asbestos exposure every year, and most of us know someone who has lost someone that they love. The failure to protect us from asbestos became a symbol of TSCA's failure to protect us from other toxic chemicals. So when the Lautenberg Act was finally passed, it gave EPA the tools they needed to do the job of protecting us from one of the most dangerous substances that we know. We fear that the failure of EPA to examine and incorporate comprehensive use and exposure information is going to mean the continued failure to protect workers and consumers, and it will signal a failure of reformed TSCA. For decades, asbestos has been all around us in our homes, our schools, public buildings, and workplaces across America. And asbestos remains in the built environment, in buildings all around us, where it continues to pose a threat to public health today. As states get back to work in the wake of the virus, among the first to open is construction work. And I live in Washington, D.C., where changes are constantly being made with buildings torn down or gutted to make a way for new construction all over the city. Since I've been working from home these past 5 months, I've been watching a gut rehab of the older apartment buildings across the street from my home. As that happens across the country, we generate and dispose of asbestos in significant quantities. That asbestos waste at landfills and construction sites puts workers and the public in significant danger. And demolition and construction are not the only on-the-job exposure from legacy asbestos. Firefighters face greater risks from asbestos exposures and related disease as they do their jobs protecting the public. School teachers, especially in elementary and middle schools, are at higher risk of mesothelioma than the general population because of widespread presence of asbestos in schools built in the 60s and 70s. EPA's risk evaluation for asbestos should have been an important tool to update our understanding of the prevalence of legacy asbestos and its risk. Without this information, how can EPA do the next job of protecting us, those of us at risk of exposure? And our concern about early indicators that EPA would not meet its obligations under TSCA led Safer Chemicals, Healthy Families, and our colleagues to file our first ever lawsuit to compel EPA to address the use and disposal of legacy asbestos in its risk evaluation. While the court agreed with us last December, the draft risk evaluation EPA issued in April failed to address the risks from legacy asbestos. The American public expects and deserves better from so-called new TSCA. The science demands better of the EPA. EPA is obliged to include and address all uses of asbestos in its evaluation, including the legacy uses. It failed to do so, failing to protect the public from this dangerous substance. This is not the action that the public is entitled to and that EPA needs for the best possible understanding of asbestos. Because of these failures and these dangers, Congress must act to protect the public from this clear danger by acting to ban asbestos now. We've waited long enough. Thank you, and let me hand it off to my friend Barry Castleman.
Thank you very much, Liz. I'm an environmental consultant and a public health scientist. I've been a consultant to the EPA, numerous other federal agencies. I've been a consultant to the World Bank, the World Health Organization. I've worked with people all over the world on trying to bring the asbestos public health threat under control. I'm going to talk about asbestos products and asbestos imports in the form of asbestos products and asbestos itself. Asbestos products are no longer made in the United States. But they are still imported. We imported last year 85 tons of asbestos yarn and thread from Mexico. In its draft investigative document, the 300-page document the EPA just published, they didn't look into this, even though we have repeatedly prompted them to find out who's importing this tonnage of asbestos yarn and thread, how it's being used in the United States, what products it's being used in, and what consumer exposures might be resulting, as well as occupational exposures. We import asbestos brake pads and gaskets, haven't been made in the United States in about 20 years. Are there OSHA warning labels that are supposed to be on these products? We don't know. The EPA hasn't ever enforced that, even though we have repeatedly prompted them to go into auto parts shops, grab suspicious products and do some testing. Asbestos cement pipe continues to be imported to replace old asbestos containing drinking water pipes that hundreds of thousands of miles of that are still in use in the United States. And many utility workers are at risk from maintenance of those pipes. With respect to asbestos fiber itself, we imported last year 172 metric tons of asbestos from Russia, which is about the only place exporting asbestos, Russia and Kazakhstan. It's all used in the chlorine industry, and it's not used in an asbestos product, but it's used in an industrial process of making chlorine that is this is an old industrial process. Most of these plants were built in the 1970s and before, and it's old technology. The newer chlorine plants don't use it, but the companies have been unwilling to convert to even the non-asbestos diaphragm material that can replace the asbestos that has been used in this industry. I have confirmed that the non-asbestos material is available. It's safer and has a 4-year payout time, which I'm told is not good enough for the industry to do on its own initiative. They want it to pay out in 2 years or less before they'd spend their money on it as a discretionary investment. So the industry has nonetheless agreed in the asbestos ban bill presently before Congress to phase out the use of asbestos in diaphragms in these chlorine plants within 10 years. So all of which is by way of saying we really need to catch up to the 60 or so countries that have banned asbestos, and by banning it, we would stop the continuing import of these products and the continuing import of asbestos eventually, even for the chlorine industry. Thank you. The next speaker is Brent Kynauk, who's going to talk about asbestos in schools and buildings. He's an expert on that. Thank you.
Thank you, Dr. Castleman. Hello, my name is Brent Kynauk. I'm the Managing Director of the Environmental Information Association, or EIA for short. EIA is a membership organization that was founded in 1983 as the National Asbestos Council. So clearly we have a dog in this fight when we talk about asbestos. Our members are companies, organizations, and persons involved in asbestos abatement and management of asbestos in buildings and facilities. Our members include the entire vertical spectrum of these persons involved in the abatement industry, which includes contractors, consultants, laboratories, training providers, regulators, equipment suppliers, owners, and managers. I'd like to use the next few minutes to talk with you about a few things. One, and you've heard it from my other colleagues, why we need our ban now. Then I'd like to talk with you a moment about legacy asbestos, or asbestos that currently exists in the nation's homes, buildings, and schools, why that's a problem. And finally, talk a moment about why our ban has not been brought to the floor of the House for consideration. First, we need our ban now more than ever. Why? There are really two big reasons. One, the Environmental Protection Agency has failed in every way possible to enforce asbestos regulations that currently exist. And two, because the EPA has before it now a perfect opportunity to ban asbestos, but again, it seems the agency will fail to do the right thing. As for EPA's failure to enforce existing asbestos regulations, one need look no further than Senator Markey's December 2015 report on the failure to manage asbestos in the nation's school buildings as required by a HERA legislation that passed in 1986. So in that report, Senator Markey outlines that even after 30 years since the HERA was enacted, the amount of asbestos in school buildings is still widespread and difficult to ascertain how much there is. He outlines that states who were given the enforcement authority by EPA have not been monitoring, investigating, or addressing asbestos hazards in schools, and that states are not inspecting or keeping track of asbestos that is removed from schools. The EPA has failed to hold states accountable for their responsibility in enforcing these very important and very well-designed rules regarding legacy asbestos. And regarding the opportunity to ban asbestos, in 2016, the Frank-Lautenberg Chemical Safety Act for the 21st century revised TSCA specifically to give EPA more teeth and greater power in banning harmful chemicals and compounds. Asbestos had long been the poster child for revisions to TSCA. And in fact, when President Obama signed the Lautenberg Act into law, he said this. He said the TSCA system was so complex, it was so burdensome that our country hasn't even been able to uphold a ban on asbestos, a known carcinogen that kills as many as 10,000 Americans every year. I think a lot of Americans would be shocked by all of that. However, it may come as no surprise to you that EPA is floundering and failing again, and the revisions to TSCA that were a clear pathway handed to the agency on a silver platter to finally enact a ban on asbestos. But EPA is falling short of this goal so far, and it doesn't seem that there's a motivation to ban asbestos, as has happened in almost 70 other countries around the world. These are just some of the reasons that we need our ban now. Let me talk about my second point, legacy asbestos. This is the asbestos that I said that currently exists in the nation's homes, schools, and buildings. Legacy asbestos continues to expose unknowing and unsuspecting people to this deadly fiber. And because we've not banned asbestos, the problem only grows worse. As Dr. Lemon and Liz Hitchcock both outlined, we have clear evidence that firefighters who rush into buildings to save people and douse fires have a higher incidence of mesothelioma from asbestos exposure than the rest of the population. And as Dr. Frank mentioned, consider the storms and storm damage as Marco is bearing down on Texas and the Louisiana coast. When storms damage structures that contain asbestos, the persons going in to clean up the mess aren't told that they might be exposed to asbestos. And for legacy asbestos that might affect each of you, I can tell you this: every House and Senate office building, and indeed the US Capitol building, contains asbestos. You might not have known that. By banning any further use of asbestos and by requiring a study on the amount of legacy asbestos that currently exists in buildings, our ban will help the US to finally get a handle on this completely preventable asbestos diseases like mesothelioma. And lastly, if our ban is so great, why has it not been brought to the floor of the House for a vote? Our ban was considered by the House Committee on Energy and Commerce in November of last year. Linda Reinstein, as she opened, noted that our ban passed out of committee on a hugely bipartisan vote of 47-1. I want to say that again, 47-1. But ironically, a lobbying organization generally in favor of asbestos ban legislation, the trial lawyer organization called the American Association for Justice, is using its enormous power to hold up the bill, saying it can't support the bill as written. AAJ is seeking arcane language changes that it believes will provide a more favorable litigation environment for its members. I believe a ban on asbestos is long overdue, and with the strong bipartisan support for our ban, this is the right time and the right legislation to get the job done. Almost 70 countries and territories around the world have banned asbestos, yet the US continues to be mired down in political mischief, even as tens of thousands of Americans die each year of this completely preventable asbestos-related diseases. It is simply unbelievable that AAJ, an organization of trial lawyers that purports to fight for justice, is holding up this opportunity to ban asbestos. It's time now for the US to finally enact a ban, and our ban will do that for us. Thank you. I'd like to now introduce you to my colleague and friend, Bob Sussman.
Yeah, thanks, Brent. My name is Bob Sussman, and it's a pleasure to be here today. I am legal counsel to ADAO, and in a past life, a senior EPA official under President Clinton, and then again under President Obama. I would like to underscore the long and uncertain road ahead to regulate asbestos under the Toxic Substances Control Act, and why we cannot wait for EPA to ban asbestos, but must enact legislation now. Under the new TSCA, asbestos is one of the first 10 substances to undergo a risk evaluation. We saw a draft of that risk evaluation on March 30th. It's been through peer review by EPA's Science Advisory Committee on Chemicals. There's been extensive public comment. And as a result of all of that, I think that we have significant concerns about where EPA is headed. The draft demonstrates the serious threat posed by asbestos and concludes that up to 1.5 million workers and over 30 million consumers are at risk from current uses of asbestos in the United States. However, the draft is incomplete and inadequate and has been sharply criticized by members of EPA's Science Advisory Committee on Chemicals. The draft significantly understates asbestos risks, focuses entirely on one asbestos fiber, chrysotile, and ignores all other asbestos fibers, fails to consider known health effects presented by asbestos, such as asbestosis and ovarian cancer, ignores pathways of exposure to asbestos, such as asbestos which is present in the environment, does not address legacy asbestos present in millions of buildings across the United States, and ignores asbestos contamination of widely used consumer and industrial products containing talc, which both Lindsey and Scott have already spoken about. So what lies ahead? It's pretty clear, I think, to everybody that EPA needs to rework the evaluation extensively before it is in a position to start rulemaking to regulate asbestos. And so we see a long road ahead for EPA under TSCA and years of additional work before EPA will be in a position to put regulations in place. And after 4 years of disappointing progress, it's highly doubtful that EPA will ultimately take strong and comprehensive action to eliminate asbestos from US commerce. As Chairman Pallone stated, quote, "It is now clear that this EPA has no intention of addressing this dangerous proven carcinogen. Therefore, Congress must pass the Alan Reinstein Ban Asbestos Now Act and put an end to this public health threat once and for all." Our ban is simple and straightforward and will achieve what EPA has failed to accomplish and may never accomplish under TSCA. This includes a complete ban on importation and use of asbestos in all asbestos-containing products, inclusion of all recognized asbestos fibers, including Libby and Fabol in the ban, a comprehensive study of the significant risks of exposure to legacy asbestos, comprehensive reporting requirements to identify all ongoing asbestos uses and exposures, and significantly stringent limits on the presence of asbestos impurities in construction materials and consumer and industrial products. This urgently needed bipartisan legislation must be enacted in this Congress. Now I'd like to turn it back over to Linda Reinstein. Linda?
Thank you, Bob. So before we start question and answers, I want to just close with a couple things that may not have been mentioned. This is an amazing panel of experts that I think as staffers, and if your bosses want to, this video will be made public. A couple of things. One is, if Mike was here today or Alan, they would talk to you about being diagnosed with mesothelioma, trying to sort out what treatment could be effective, managing that treatment, paying for that treatment, and then for the families, we bury our loved ones. These are all preventable diseases, as Dr. Lemon and Dr. Frank have talked about. We don't want to discuss, is one fiber more carcinogenic than something else? It doesn't matter. They're all asbestos fibers are considered a human carcinogen. We have the policy to move it forward. We have the time to do this, and with your boss, we can. I think it's very important to look at a few things. That one, through the hard work of the Energy and Commerce Committee, the ACC, the powerful lobbying organization for the chlor-alkali industry, have actually come up with a compromise and a deal, so to speak. They will transition from importing asbestos to using their stockpiles within 10 years. That's actually less than Canada. We have every industry group and public health stakeholders on board for this bill. I'm pleased to share I'll be writing a report about imports, and as Dr. Castleman talked about, there's materials that come in as well. But the good news is the imports are down. I think industry totally gets that this ban bill is going to move, and the imports for 2020 so far are down. It is unreasonable to think that the US spends dollars putting miners at risk in foreign countries to mine asbestos for commercial use, when, as Dr. Castleman said, safer substitutes exist and they're economically viable. I want to make sure that when you hear from industry, if somebody has a chatter about why we can't pass the bill now, that you give us, this panel, the opportunity to answer your questions. It is unconscionable to think that we have a landmark bill sitting in the House waiting for the floor, and to not act is doing a disservice to Mike Mattmuller and the hundreds of thousands of Alan Reinsteins, and we can, in fact, do this. What I see in most staffers' faces when I personally greet them at our briefing is they're scared. They're young staffers. They live in DC, like Liz spoke about, as far as new construction. They don't know where asbestos is in their home or in their built environment. And as Brent says, yes, it's in the Capitol buildings and White House. So we owe it as Americans to make sure that we can mitigate and eliminate all asbestos exposure. And I think that we can with this bill, and we're ready to move forward. This is an impressive briefing with the material that you have, and we want to be able to answer your questions. I'm going to look into the chat view now to see what questions have been popped in there. And I'm reading now. So Celeste, as part of APHA, you've been working on this since 2009 with your policy statements to ban asbestos. What do you want the members in Congress to know from APHA? Because clearly you and AFL-CIO are the largest stakeholders in this debate.
Well, even before APHA had the formal policy statement, there was recognition since the 1950s about the hazards of asbestos. So that was really just putting it on the record. But APHA is all about prevention. And this is such a simple step that can be taken. I mean, it's not been simple to try to get it done, but this is a potent carcinogen, and we should not be having more come into our country, and we need to deal with all of the asbestos containing materials that are here already.
Excellent. Lindsay, question. If I'm a consumer looking for cosmetics or possibly something for my home, how can I find out if a cosmetic could be contaminated? How can I do my own research? And I know EWG has also done great lists, so Scott will throw that to you as well after Lindsay finishes. How can I find out if a product that I'm buying could be contaminated or is contaminated?
Simply put, consumers don't know, and it's really impossible to find out. The best thing that consumers can do is ask really tough questions of the brands that they purchase from. Oftentimes the responses you get are unclear and don't really give you the information you need in order to make informed choices. That's part of the complexity, especially with things like asbestos, is it's not something that's going to appear on an ingredient label. And so it's not like the market can just fix itself. It's exactly why we need Congress to act now, to take action and join the plethora of other countries who have taken steps to ban asbestos.
Thank you. Scott, do you want to add to that? Because you have some great resources at EWG.
Sure, I'll just add that you can certainly just read the label and look for products that contain talc, especially loose and pressed powders. As Lindsay said, companies are not required to test for the presence of asbestos. They're not required to share those results with FDA. There's no way to know whether or not they've actually done any of the testing or what testing methods they've used. So if you are concerned and you see a product contains talc, you can look for alternatives. And many companies have begun to switch from talc to other ingredients, including cornstarch and other minerals that are equally as effective if you're buying a personal care product. So that's a simple life hack for folks who are trying to at least reduce one potential route of exposure.
Great advice. And EWG has some wonderful lists on other toxins too, how you can make your home and your life safer. So we'll throw those on the educational resource, Scott. We are going to be presenting next week to the House a petition that has nearly 150,000 signatures on it. We think that's an impressive amount of people in the US and around the world calling on the EPA to ban asbestos. Obviously, as Bob Sussman spoke, they're on track not to ban asbestos, and we can't afford to wait another 4 years for an empty promise. We held the Lautenberg bill, and I know Lindsey had worked on that, and of course Liz and many others, Scott. We hoped so strongly that it would be done with the TSCA, with the Lautenberg bill, and EPA will be announcing soon, I am certain, that they have failed again. So it will be, Congress is responsible for passing legislation to prevent exposure. So if you would like to get involved with the petition movement, we welcome your support because we would love to have a powerful petition that really shows the power of the people is behind banning asbestos. That being said, kids are going to buy cheap stuff at dollar store. Yes, that comes from Celeste. It's a private message. There is an action, and I believe Lindsey's involved. I'm not sure, Liz, if you aren't, I'll make sure you're dialed in. There is a social action with J&J who did announce that they would no longer be selling their cosmetic, their J&J powder that's contaminated in North America. We, as women and men, public health advocates, don't think that's enough. We think J&J should dump all of it and not distribute it in any developing country to anyone, nor should they be allowed to take a tax write-off for making a significant donation. So there's a social action campaign that will start on August 31st, and I will put that also on the staff resource page. I think that gives us even a stronger impetus to work on passing the Alan Reinstein bill. As Lindsey spoke well about the jurisdictional difference between EPA and FDA, if we take a step forward with the EPA, I guarantee you the FDA will soon follow. We have to start somewhere. We have all the evidence and the science we need. We just need to get the job done. I don't see any other questions. So with that, it's 9:01 on my California watch. Please be safe. And most importantly, thank your boss for being a strong leader in trying to reduce toxins in America. We look forward to our next briefing. And thank you to the wonderful presenters this morning. This briefing has concluded.